My name's Megan Walters and I'm from Social Services. It is.
I'm Helen Davis. I'm the manager in the Social Services Department.
Joe Powell from All Wales People First.
I'm Mary Rental, and I didn't really expect to be on the panel, but Caris, who is our manager of social services, is not able to be here, so I'm standing in for her. Okay.
My name is David Sears. Article 30 on the Union. Never got it right. On human rights. That people with learning difficulties to have all access to leisure of sports. So why is it that will changes do have difficulties?
On behalf of David Sears, Article 30 of the UN Convention on Human Rights says that people with learning disabilities should have equal access to leisure and sport. So why is it that wheelchair users still have difficulty accessing the theatre and car parking, which limits David from taking part?
Anybody wants to answer that? Which theatre specifically? Aberystwyth Arts Centre. Aberystwyth Arts Centre isn't actually owned and funded by the County Council. It's a separate organisation. As far as I was aware, it was fully accessible. From my own personal experience, having used it, I thought it was fully accessible, but it clearly isn't then, is it?
The car parking spaces are too few, especially for busy theatre runs, where there are multiple people using the same time. And also, the disabled spaces in the theatre itself are very small.
Right.
And also used by people with prams. So, there's very limited space.
Have you taken that issue up with the Arts Centre directly? Has David?
Does Joe Powell want to answer that or say anything about that?
To be honest, it's difficult to know what to say, to be honest. The accessibility, all I'll say is I suppose, on a wider thing, I suppose from an All Wales point of view, well, people first generally, what we are finding as a general difficulty is, I suppose with the upcoming social services and wellbeing bill and things like that, and at the same time there are a lot of cuts to things. We are anxious that at the same time the bill's talking about increasing access to things and giving people opportunities, but at the same time we're cutting things to allow that to happen. Okay, that's a very general thing, but I think this is one of those situations as well, potentially, where what we deliver and what actually is out there can be a tricky bit, but unfortunately until all the finer details comes out about the bill, it's going to be very difficult to see how it works. That's all I can say in a very general way, to be honest with you. We're still trying to get to grips with that.
Can I make a comment? I don't know if anyone watched the One Show on television last night. but they had an article about wheelchair access, and the conclusion that they came to was we are going to have to challenge this every time it happens. I know that Aberystwyth University has got an equality policy, and that they say that all of their services should be equally accessible. So I suggest that although it's really hard work to do it, we have to, when this happens, every time it happens, say something, even if it's to the person on the reception desk, use their complaints procedure, use their website, every time. We're just going to have to get militant.
But actually, I know from people who have used the theatre in Aberystwyth as people with disabilities that the service there can actually be very good. So I think the point that you're raising isn't that they haven't got the access or they haven't got places for people to sit in the theatre or places for them to come. But what you're saying is there aren't enough. So it's about going back to the theatre and saying, great, you've got these resources, but actually you need to double them and you need to provide more.
Hi, can I add a comment about this?
Okay.
During one of our members' meetings of last year, I can't remember if it was last year or this year, we did actually write a letter, isn't that right, Claire? We did actually write a letter to Aberystwyth Arts Centre and University about the accessibility and the cost problems, and unfortunately they haven't had the courtesy to respond, so I have tried, we have written several letters during the course of last year and 2012, so thank you.
My name is Karen. What else? What does it say? Why does people so learning disability getting the work screaming?
So I'm just going to repeat that for Karen, or for you really. Why are people with learning disabilities not getting regular health screening? So that's checks even when nothing is wrong. Anybody wants to answer that?
I don't know if you're all aware of the 1,000 Lives project, which has just been launched by the NHS. But one thing I'm encouraged by is with Mencap Cymru actually were the ones who kind of started the ball rolling with it, and there was the death of Paul Reid in hospital. So from an All Wales, although kind of where people first, at the same time I was very, very encouraged when I was there about what's going on, and in actual fact with the 1,000 Lives project, what's happening with the Welsh Government, they're actually spending a lot of time now, hopefully, and that's one of the things they want to address and get people screened. There was difficulty with the Equality Act, the Equality Legislation Act, which meant people were too frightened to do anything, and the mental capacity and all that kind of business. But I was personally, just from my own experience, again, like anything, you don't know till it unveils, but I was quite impressed with what the Welsh Government's done with the NHS. Personally, it looks like they've certainly tried to address it. But all I'd advise is personally, and this is something we always say, is, look at legislation, look at anything that's put through and use that to hold people to account. So if people are talking about it and it's satisfactory, that's great. But, always be aware and always just try and bring that back to people. But at the moment, I think it's certainly on the radar from what I've seen, but obviously we have to look in practice to see, obviously, what happens to that. And then something I should have said earlier, which I was reminded of as well, about the car parking and what have you. All Wales People First can certainly help to write a letter about that if that's of any help, coming from the national organisation. I don't know whether it would necessarily have any extra strength coming from us or not, with it being a local issue, but certainly that's an option, should anybody want that.
I think on the health checks, there's probably still a question of whether people are aware that they can have them, and because they're funded, aren't they? Every one is entitled to have a health check annually, and perhaps the question is whether support staff and people who provide So there may be more that we can do about that, but awareness is one of the issues.
But it's also about, it's not automatic.
Yes.
You have to go to your GP and you have to ask to have a health check every year. They won't, in the same way as you get breast checks, comes through the post and you go automatically. That doesn't happen for health screening. You have to go and ask the GP to have your check. So I think that what you're perhaps asking is, can that be automatic? Can you get a reminder every year to tell you that it's now time for you to go and have your health check? Well, that doesn't happen currently, you're right, and perhaps that's something that we should be flagging up for the future.
Basically, I find that the health check is a waste of space, number one. It's all right for those people who've been long in this country, over, for example, my exemption of 28 years, but I find that if you go to health check, the doctor knows what you've got on the screen and what you've past, present and future. And most of the doctors, they employ the doctors that from EU members of the countries, and they don't even understand autism whatsoever, what your disability is about. It's pointless. I think it's all right for those people, the doctors are local, but the problem called the Privacy Act 28, the United Nations says everyone has a right to privacy. But the problem is they bring in the past, stirring up old hard hurts upon families and divorced families, separated families, and it hurts. I waited 6 months for a tribunal last year, and my PA, my key worker, and the forms, and the interview was cancelled, and I had to go the next following day. And that room, I didn't get sleepless nights. I got asthma as well, and it's pain in the neck. So I speak for the majority.
Anybody want to respond to anything?
Yeah.
Just pick up on last.
I think you're talking about the ATOS assessment and the appeal queue, and I have had quite a bit of experience of the ATOS assessments and the appeal process, and they are pretty bad at cancelling at the last minute. I'm quite interested, and the Citizens Advice Bureau did a big project on that last year, but they also have a complaints process, and if they cancel your appointment at the last minute, or they keep you waiting, or they change what they've told you will happen, give me a ring and I will help you use the complaints process, because I think unless we use it, it won't change. Okay?
That's great. Next got a point, is that the same subject? I've got all the questions.
Good afternoon. I would like to ask why the County Council hasn't told the social landlords to repair homes that are falling into serious disrepair, because my flat is really falling apart. I've gone to my landlords, they can't be bothered. So could the County Council please come and get them to look at the windows, the heating system, because every night I'm freezing cold. My flat is falling apart, it needs serious repairs. And yet they've taken this off the maintenance list. I don't know why.
Are you talking about a private landlord here? Okay. Well, in that case, you should be getting help from your support to go back to Tynecamshire and to get them to come out and address the problem. Certainly, we can, from our end, be, speaking to Tynecamshire about that and asking them for an assessment of your flat. If I can have your name and address at the end, then we can perhaps help with that.
Anybody else want to say anything about housing or state housing? Is it related question, David?
I just want to say something, because I just want to ask you, because some people, I just want to say, because I will charge because people first... What's on a meeting about? There's always a meeting about the people first, people first tries a meeting about houses, about the house of people's, all the people's houses. But my house is the same. So all the people come from my houses to all the people around my house. So you're going to know about my people that pass my house and see where it be. Because I destroyed my house is about my house.
But what is the actual question, David? What is the question? About speaking up in your house? About being able to speak up in your house?
About people shouting.
About people shouting in your house? Okay, good question. I'm not totally sure of the actual total question, but it sounds like David's sort of saying that he wants to or needs to speak up about shouting in his house. We have got questions about housing, but that is a spontaneous one, so...
So, who's the landlord?
Is it a residential service? Sorry. Is it a residential service that you're living in? Is it like a care service? And you've got people in the house that you're not happy with their behaviour? And is the question, how do you raise that issue? How do you put across a complaint about that? They want you to move.
We've talked about this today, haven't we, David? And the moving is because they're going to do some work on the house, so you're going to move out. And they're going to renovate the house, and then you're going to move back in. But the shouting is different. And so if you're not happy about the shouting, I think you should tell the support staff in the house, and I think you should tell your social worker. Okay, good. That's all right then. And maybe again that's something I can follow up as well.
Just going to add to that as well. If you do have a complaints procedure as well, within a care service, if it isn't adequately dealt with, you can then go to obviously the CSIW after that, the care standards and standards. So I just thought I'd chuck that in as well. I don't know how useful that would be, but something a bit extra. But unfortunately, the CSIW will not deal with it until you go through your own organisation's complaints procedure as well. So.
My question is from Article 23, the rights for respect for family and friends in the home. My question is, I'm in supported living currently in Clinview Farm, Aberkeith, near Kennaugh, on the border between Ceredigion and Pembrokeshire. So my question is, why can't I have people over to stay in my supported living tenancy?
Could I ask you to repeat that phrase? Sorry, you didn't quite hear it.
I live in a supported tenancy in Aberkeith. So my question is from Article 23, the rights for respect for family and friends in the home. Why can I not have people over to stay within my supported living tenancy?
Right, I don't know quite how to answer that one. Does anybody have any input?
Right. It's really difficult to say without knowing more about the situation, because in some supported tenancies there is space for people to have friends or family to stay, but there are also rules about who can stay, and there are terms and conditions to the tenancy. So it may be about the needs of other people who are in the same place. and it may be about whether there's actually room for extra people to come and stay. I think because it's an individual situation, the best thing to do is to ask your social worker or ask someone you trust to try and find out more about it. It may just be that it's the particular place that you are in at the moment, and it's really hard for any of us to know the answer to that without knowing a bit more about the situation. If the social worker doesn't listen, use the complaints process.
No.
Well, social service don't care about you, but that's not. They wreck people's lives. Like they wrecked my friend's life, bringing these new people in and new staff out telling people and do it behind people's backs. And this lady called Rebecca, she threatened me, and I told Sally about it. Does anyone care? No. No one. Social service don't care about it at all. Just chuck you in one corner. Thanks, Claire.
Where would you like to respond to that? It's not a question, it's a broader statement, isn't it?
Just to say, I think that is a really awful situation, and we've had a chat about that, haven't we, Raymond? And I'm going to see what I can do to help with that. Okay. So I can't. There are no answers to that today, I'm afraid, but I am going to try and sort that out. All right? Including using the complaints process, if that's.
Hugh's got a question related to phase actually, so we'll just hear from Hugh's question. It's about housing.
If I could take the pressure. Okay. I live in a men-cap home. I live in 25 Queen's Road, Aberystwyth at the Ceredigion of Wales. Do you think it's right to anybody to not allow any people to visit the house after they bring this new law out that nobody's supposed to live after 8 p.m. Visit after 8 o'clock. According to Article 28, everybody has a right to privacy. If they bring this law out, it's going to include parents, student friends, and so forth. And I come from late hours on weekends. They've changed the staff, the timetable, and it's a lot of people. Me and my friend have been in the house for 13 years. We've lost 2 tenants due to a stroke and a heart attack, and I've got mild condition, autism and asthma, and I don't like changes myself. Joke aside, how many people does it change your life of? Nothing, change.
Just want to grab this for a second, if you don't mind, Hugh. I'm actually in the process next week of writing to the director of Men-Cap Cymru about that, so just to reassure you that that's on the cards, because it was raised in our national council. That should never happen. I've just been appointed to the board of the Care Standards Inspectorate in Wales. It's never had a board before, so for the first time it does have its own board. So I'd just like to ask people, please send me all your anecdotes, because they've got a new manager, there's a new system there, and I really think they're going to try and do things, and I will certainly hold them to account for things like that. But certainly the anecdotal evidence would be really, really important. So, I hope that helps in some way. I know it's not an immediate answer, but what I can say is that they are aware of the situation, not just in that situation, but generally of this culture. So people are aware. It's just about trying to get to the bottom of it and change things around. I don't know if it...
Yeah, so just to reiterate, in Hugh's house they've just made a rule which is that people can't stay, you can't have friends after 8 p.m. And sorry, and that sort of contravenes actually Hugh's right to a normal pattern of life. That was in the Orwell strategy in the 1980s. We're now in 2014. How can Men-Cap be making those rules. Sorry to butt in on this, but I feel strongly that, you know, as a 40-year-old man, that cannot be okay. And men can't get paid to do this. And they've got their own campaigning arm, which is all about staying up late and things. Does anybody want to say anything about that? About what you could do, or are you aware of things like this, that the county council is paying men to support people in this way?
Yeah, I think just to make sure that it's been reported as a service concern to our contracts and commissioning team, I think it's indefensible. So, but you really have to follow the right channels. And again, if Hugh wants any assistance to make sure that it has been reported, I'm happy to do that. Yes. Yeah. Okay. Did you want to say something? Slightly different, I think. Yeah. Overnight stays would be different, I think. Yeah.
So this is May, and they were talking about health. And Fred's got a related question, which I'll ask Fred to ask. So May's question is, how can we make sure that staff in hospitals communicate well with people with learning disabilities? And Fred's question... Fred.
Can you read out?
Why can't hospital staff? So why can't...
Can you come on here?
Sorry, Fred.
All I was to say is that the nurses in hospitals, disabled people, they try to avoid for having to help people. The same as I was when I was in hospital myself. I got suffered about it. It didn't come near me at all.
So people in hospitals didn't talk to you? They didn't talk to you, they left you alone?
No, well, it's only one man that talked to me. There was only one man that gives you injections for your blood.
Yeah.
That's the only man that ever comes to speak to me.
Okay, so that's two questions there about health and communication in hospitals.
I suppose I'm referring back to what I said before about the 1,000 Lives project with the NHS. I know that hasn't kind of come in yet, but just to remind you as well, in that, one of the things they're talking about now and actually starting doing is to have learning disability liaison officers now who will, the idea is that they identify straight away somebody with a learning disability, give them the right support. Obviously that has to happen and we have to hold them to account for that. But also at the moment, this work, it's all being, there's a consultation going on and there's feedback to that consultation. So I would just encourage people, I can send Claire the link if that's any use, all the members, you know, please use that consultation, please feedback, because we're not going to know until it actually comes out if they're going to stick to that stuff. But any loopholes in that, you can hold them to account. But more importantly, once it's in black and white, this document 1,000 Lives, once anything's in black and white, hold it up and brandish it if people aren't sticking to it. You know, that's the way to challenge it. But unfortunately, you know, it's whether or not it's going to actually happen or do everything, we're not going to know until it happens. But in principle, this 1,000 Lives document says it's going to do it, it's going to put it right, and then it's going to name and shame hospitals that don't do this kind of stuff. So that's all I can really say about that.
Just to say about hospitals, you know, you'll all know that there's been quite a lot of information in the news lately about how hospitals haven't been supporting elderly and disabled people enough. So that's not just people with a learning disability and physical disability, but also people with mental health problems. So the important thing is that if you have personal experience of it, that you then make a complaint to that hospital, so that everybody will see. Did you want to say something?
I said, I did, and we didn't get no answer.
Right, did you make a complaint?
Yes,
In writing?
in writing,
All right, did you have a response?
and it wasn't, nothing was done about it for last.
I think that unfortunately, where we are now in this country is that if you make a response and you don't have a response, you have to make a complaint again. You have to make a nuisance of yourself and repeat your complaint until you have a satisfactory response.
Does everyone know about the Putting Things Right campaign as well in Power of Our Health Board, which is a new approach to dealing with what hasn't been okay about your experiences in hospital? I've got some information about that if anyone would like it, and also to just say that it's really important to take your health passport with you to hospital. I had a chat with Fred about this earlier, and he thinks there are things about the health passport that could be improved. But the health passport also should have lots of things about you on it, about your likes and your dislikes, and how people can communicate with you, and sort of a traffic light system about what's really important to you. So everybody, I think if I was going to hospital, I would want a health passport as well. So I think everyone should know about the health passports, and maybe that's again something in our team we're really trying to publicise the health passports and make sure everyone knows about them, but we've still got a bit of work to do there. You did want to say something?
There is a copy of the health passport over there, if anybody wants to have a look at it. Also, on a more practical communication side, we are now starting to provide communication training in the hospitals. Obviously, there's a massive amount of staff, so it's going to be a very slow process. But I know in Pembrokeshire and Carmarthenshire it's been happening for a while, so we're going to be starting in Ceredigion now soon as well. So if there are any communication difficulties or problems, we can help you with that. You need to give us a shout, I guess, and we can help. And there's a passport over there if anybody wants to have a look at it.
Hi, I've been with the Canada Health Centre for about 7 to 8 years, and I've been trying to transfer my doctor's surgery to Aberystwyth, but I've been told all of them are full up because of all the students. Now, that goes against my rights to have good healthcare, because I can't get to the doctor's surgery out in the middle of nowhere due to having no transport. Now, that put my care under my mum's supervision, and my mum's too busy for that. So, is there any way that the Welsh Assembly could actually bring more doctor's surgeries to Aberystwyth so people like myself could get decent health care? Because right now it's appalling.
This is going to be a bit of a bum answer, this, Nick, in a way, but I think it's like you were saying before about the individual cases situation, to be honest. It is really difficult to answer from that personal point of view. Yeah, I think we're stumped by that, to be honest, without knowing any more details, so I thought I'd at least give you an answer, but the answer is we don't have any answer, unfortunately, to that. Yeah. No idea. I know my own region as well, with dentists and things, there are quotas for how many NHS patients to take on and different stuff, so I really don't know. So apologies.
I was just going to say, say, if you've got difficulties getting to appointments, there are volunteers that are able to transport you to appointments. There's a volunteering car service, isn't there? So the best person to speak to would be a social worker in the first instance to organise that. I don't have one. Ah, right. What about the surgeries themselves?
It's outrageous. Yes. You have to wait 2.5 hours to live in the village for another bus back. That's no good.
I think, what about Calvo? Yeah.
From Carol.
I don't complain about it. I get on with it because I do it for volunteer, and I don't complain. I don't get it, and I just get on with it and do it. That's what I do. Get on with it and do it. Never play.
And
yeah, Jenny, my key worker, and she got me a job, and she got everybody. And because I don't do it, I do it. I do the pen in the shop, and I can't do everything. I don't play about it.
yeah, so Karen, you're talking about your work that you do, and you don't complain about it, you just get on with it. But there were some thoughts in that group about people getting paid work, and that's really difficult for people in Ceredigion to get paid work. And Coastal is about to end. Does anybody like to talk about that at all?
The Coastal project, as it is now currently, is due to the European funding is due to end in June. There's still talks ongoing at the moment to see if there's any other opportunities for us to extend the project by getting other grant funding in. But in terms of people getting paid employment, we're hitting our target, and we've, I think the latest number is around 34 people that we've managed to get into paid employment over the course of the project. And it has only been running just over two years. So that's a significant achievement for Ceredigion. We were the last authority to come into the scheme, and we're the first to reach our target of getting people into employment. So we're very pleased with that. We know there's a lot more work to be done, and we're hoping, whether we get extra funding or not, that the principles of Coastal supporting people to access training and employment opportunities will still continue.
How will that be funded? How would that be funded?
Well, there won't necessarily be a dedicated team, because what the funding is there at the moment is being used on in the main is to get a dedicated team of people progressing with training and employment opportunities. Now, if the funding ends, then the likelihood is that team will also end. But the principles of everybody working towards people getting into these training and employment opportunities will hopefully then be embedded within the teams. So, as social workers or support workers, we always work to support the people we work with to access the best opportunities that are available to them. So it's that principle that would continue as opposed to the dedicated staff.
A few of our groups who were involved in Coastal were really unhappy with the outcome of Coastal and asked me to write to the Minister about that, which I did, and they were appalled by some of our group's experiences as well. I won't give too many anecdotes here now, but they were quite damning, and they were furious. The ministers were really upset, and they're getting really involved in that now. they've been liaising with me and keeping me up to date, but the AMs are looking into it. And in actual fact, Carmarthenshire People First even started up their own job club because the impact of coastal was so poor. They actually started their own job club up as a response to it. And that actual job club is being used. The coastal have asked Carmarthenshire People First if that could be their exit strategy out of coastal as well. So really, and it has been negative. So I would just like to say, from the People First point of view, from what I know about that, I do hope whatever does come in, will be consultative with members and will be something far better than coastal, because from the experience of people with learning disabilities, it hasn't been very good from what we fed back, and to our other member organisations, Learning Disability Wales, Mencap Cymru. Generally speaking, it hasn't had a good feedback. It's done well in other areas in terms of rejuvenating town centres and all that stuff. But for employment with people with learning disabilities, I can pass on the anecdotes if you want. I won't say them here, but they're quite damning.
There have been some issues with some authorities, and I think Carmarthen was one of the ones that was really falling behind its targets, and it had actually started long before we started. But in Ceredigion, I wouldn't want you to be making assumptions that the experiences in Carmarthen have been replicated in Ceredigion. As I said, we were the last authority to join Coastal, and we're the first to achieve the targets that have been set in terms of employment outcomes, and that includes people with learning disabilities as well as other disabilities like mental health, etc.
I was going to say quickly as well, anecdotally, we've had a lot from Ceredigion complaints as well, things like day centres, money spent on things, repainting and refurbishing buildings that haven't been used. We have an awful lot about Ceredigion, which have been fed back as well. An awfully bad experience, which again I can pass on the anecdotal evidence. Rebecca Evans is looking at it at the moment, and a few of the other EMs. Sorry.
Just Jonathan first, just Jonathan, and then you.
Could I ask a question why it is that local authorities couldn't employ more people with learning difficulties and set an example?
As I've said, out of the coastal scheme, we're on track to get 34 people with disabilities into employment, and a number of those employment opportunities have been within the council. Not necessarily, I can't say specifically whether any of those are actually with learning disabilities, but certainly a number of the 34 employment outcomes are within county council premises, like kitchens, for example. There are a number of coastal employees now working in council-run kitchens. Does anybody else want to add?
Just, I think this is something that the Welsh Government is looking at very closely. I kind of share your frustration, because over the years I've worked with lots of people who really just wanted a paid job, and it has been so difficult to find those opportunities, particularly opportunities that last. So I kind of sit on both sides of this fence. It's been a long and difficult and frustrating journey, and it still is. But the Welsh Government has recently commissioned a study in Glamorgan looking at what needs to be done to support more people on the autism spectrum into work. And I'm going to a meeting about that next month, hopefully to bring back that information about what we can do here. And I think that also we do have people with learning disabilities working for the council and in our departments. We could have more, and there are a lot of big challenges and hurdles. I think we would be a bit naive to sit here and pretend it's all okay, because it's not. But there is work going on. Perhaps it's difficult for you to see it, but there is work going on to improve the situation.
So who's got a comment from Nick wants to say something, and hopefully we'll have time for Mary's question as well.
Hold it. Basically, I just wanted to ask the person about Coastal. There was a particular man, Mark Warner, that actually came to our house about a year ago, into Mary and Pat's house. He walked straight in without even knocking. into the kitchen and was quite rude to the point where he was trying to bully Mary and another girl to come to these coastal meetings. It wasn't the first time that he'd walked into the house. He actually did it again after, you know. It's quite shocking and distressing for like someone who's a complete stranger in a way walking into your house, you know, without your permission. You know, so I just wanted to ask basically, why is that allowed? You know.
So brief answers.
I would just say that, did you follow a complaint process on that?
We actually made a complaint to them. It was two staff members. I know I was in on one of the days where he just walked in and, you know, he introduced himself. He was like, oh, why is she coming? And we were trying to explain to him that Mary has a skills there on Friday. Without prior knowledge, well, we had knowledge of this, you know, and she's obviously autistic and likes to set routines. So that's why she wasn't. She didn't get enough notice. But it's the fact that he actually came not once, but twice, 2 occasions, walked into the house and was disrespectful. And, you know, at the end of the day, it's Mary's house.
Did you follow?
And we did make a complaint about it, and apparently, I think he has done it before. So we found that quite extremely, you know, it shouldn't have happened.
Did you get a response to your complaint?
I think one of the actual management actually dealt with it herself and made the complaint about a particular man, but I don't know the outcome to that. But I just want to know, as an organisation, why do they feel, you know, that it's their right to go into someone's house for a start? And if someone doesn't, you know, like Mary's situation, she does a lot with the community, an awful lot, don't you, Mary?
Yeah.
You know, so she shouldn't feel like she's bombarded into things that, you know.
Absolutely not. And as an organisation, that isn't an acceptable practice. It's an individual's practice, and I'd be interested in following that up really to see whether a complaint was actually processed and how it is dealt with. So if we can have the details of that, then we'll follow that up and get back to you.
Because, you know, if you've made a complaint, and you've spoken or written about making a complaint, then you're entitled to actually have a response in writing, explaining to you what's been followed up.
Okay, can we we've heard that particular thing. I just wanted to give a chance for Mary to ask her a particular question.
Tell the lady in the microphone your name.
Yeah.
What's your name?
Ray Matthews.
Article 30
Article 30
of the UN
of the UN
Convention.
UN Convention. UN Convention.
Human rights.
Is that right?
Says that people
with disability
should have equal access.
have equal access
To books.
to books.
Yeah, the RNIB
Royal National Institute for the Blind.
have been forced to withdraw daisy players.
Daisy players.
This is an audio machine.
Audio compact display.
Yeah, because of cuts to their fundings.
Because of cuts to the fundings.
It is it right?
Is it right?
That I can't access books.
No.
It's not right.
No.
Because I can't pay the £300.
Because I've had them for 48
Yeah.
years.
You would have to pay £300.
Yes.
Yeah.
Okay, someone can answer that, so okay. Anybody would like to answer that? Did you get the question? Did you read the whole question?
Basically, it's Article 30 of the UN Convention of Human Rights says that people with learning disabilities should have equal access to books. Yet the RNIB have been forced to withdraw daisy players because of cuts to their funding. Is it right that I can't access books because I can't afford the £300 to buy my own daisy player?
And daisy player enables people that are blind to
Yeah.
read books.
System.
Yeah, okay, thank you, Mary. Anybody got any thoughts on that? Anybody any thoughts on that?
that we can do in terms of we may be able to find some funding specifically for meeting people's sensory needs. We can have a look at that. I haven't been asked to have a look at that, so this is a bit out of the blue. I presume it was government funding. I'm just interested to know who withdrew the funding. There's a wider issue, isn't there, of funding for the RNIB, and then there's the individual issue of how do we meet Mary's need to access books. And I think that is actually an individual social worker and case management issue, and perhaps if Mary really doesn't have that £300, that's something that we need to look at as a department in terms of meeting the needs.
She's also actually currently been told that she's not having to communicate and know things now, which I think people mould themselves. So about a hefty price of £2 that she's going to fork out for these molds that will benefit them. And we're currently trying to go through social work to get funding, because obviously that's a lot of money.
We think that should be health funding. I'm not sure that any of us are able to answer that either, but it's really difficult to answer the individual issues, isn't it?
I'm noticing the time, it's 1:45. Do you need to go right now? Okay. Can you stay? Well, we can test on the last two questions. Is that right?
Thank you very much for inviting us along here, and I thoroughly enjoyed it.
That's really great. It's really great for people to air things and we can all hear them as well and hear your answers. So thank you very much for coming. So, I think we've got two more questions. One is Faye and one is David Brown. Faye. It's about choice.
My last question is, why is there not enough options for first-time housing users such as me, and why aren't there more adult placements or cheaper areas for first-time people moving out to use? Why is it so expensive? Because why can't there be? Because there's not enough choice in housing for young people. Because for example, in Ceredigion, when I was choosing the adult placement model, I didn't even get to choose my adult placement. I had to be put in one and told where to go. But there's not enough adult placements and places for young people to go. And they're put where they're told, but there's no choice for young people, and there should be more choice.
So that's a choice for young people moving into housing.
Well, I would agree with you. There isn't very much choice at the moment for either young people or older people in Ceredigion in terms of housing provision. But that's not because we don't try to increase it. There's been quite a lot of work recently on supported housing for young people. I know that Ceredigion have opened a couple of new units for young people who need a bit of extra support when they're moving out to live on their own. But it's very small. In terms of numbers, they're very small. I would agree with you. But this is one of the things that in Ceredigion we do struggle with. It's a small county here, there are not many people living here, and as a result of that, we have less facilities and less capacity to be able to spend money on increasing them. So it is an issue. If we were living in a big town, in Swansea or Cardiff, there are more facilities, there is more choice. But then sometimes in those areas, there are more people wanting to get into those facilities as well. So people aren't always better off. Sometimes they have to wait for a very long time in bigger places. So we are trying, in the County Council, we're doing a lot of work with housing agencies to try and get more things provided. But it is very slow, I would agree with you.
I would just add to that as well. This is such a big problem, I think, nationally from everything, not just within learning disability generally. So I think this is such a big topic, even bigger than the learning disability one. So I think in terms of, representing people with learning disabilities, this is something where maybe people first themselves, maybe at some stage need to have a chat and see how we represent ourselves. But I think unfortunately this whole housing problem is one that's affecting everybody, is it below the age of 25, regardless of that. So I think this is such a major, major problem. I think it's even bigger than just the learning disability. Well, it is bigger than the learning disability issue. So where we come into it, or how we get represented, I think that's going to be a major challenge. I just thought I'd chuck that in.
I'm actually going to be quite sneaky and just get Rebecca Planton's question in.
Yeah, this is a human rights issue. Why is it that sometimes people with learning disabilities living in residential care can't go out and do things that they want to do in the evening because of staff shortages? And this seems to be a recurring problem, that people can't attend outings and social activities.
And just to say, I got a phone call this morning to say that 4 people couldn't attend because there was not enough support. And that was just one phone call I had.
This is an interesting one because I lived in care services for 11 years and I've got so many stories, but one of the things I did, have you heard of Heavy Load? It's a learning disability punk band, and I was doing a brokerage speak about individual budgets. This is when they were first kicking off and everybody thought they were witchcraft, and I went to this event and they were on about 10 o'clock and we went for 10 o'clock to see this band because they were famous and they weren't on. And we couldn't understand why they weren't on, and said, we rescheduled them for 7 o'clock so the staff could take them home. The staff had to get back and get off for shifts. But the whole conference was about changing the mood and changing what's going on. All I would say is and it's not really an answer, it's more of a comment. To me, things aren't changing. And I've said this, those who've heard me speak before, I apologise, but this cultural thing is incredible, and things within services at the moment just aren't changing. And to me, it is the prerogative of staff to do what they like at times. To me, we look at abuse as things to do with gross misconduct, and to me, it's a much bigger, much broader pattern than that. But basically, yeah, this is why I don't believe in person-centred planning, because I don't think if you're a communal organisation, you can achieve it. But yet they sell services on the back of it. And services are sold on the back that we can give you what you want. You can't. And what you were talking about people being in certain times, to me, just frankly doesn't surprise me. And it's because people are running businesses and people are running organisations. And, unfortunately, a lot of what we should have as rights and actually what is happening are two completely different things. And I don't think it's highlighted enough.
Same answer. Just one last question off David. This is your question, which I don't totally understand, but I'll give it to you to explain, David.
Sorry. Really? It is working. Why I have to pay more out in ILF, and I have tried to have income support to help me out on a man-cap house, where I have to move out of a man-cap house, and why to receive income support. Why can't I have more man-cap hours than ILF?
You've told him different things and he's very worried about it. So I've said that I'm going to try and help him out with it. I'm going to try and find out what's happening and I'm going to try and help him out with it. So that's really all I can say. It does seem as if it's not a fair situation for David at the moment. It's a bit worrying him, isn't it? So that's all I can offer, really.
can I just like to thank all the speakers and the panel for answering the questions. We're now going to have a break and then we're into the AGM. So thank you everybody.
There's tea and cake. Yep. There's loads more sandwiches.
Take it back.